All right, everyone, welcome to our education event today. Some of you probably know me already if you joined any of our virtual events. My name is Aurelis Cortez, and I'm the event coordinator at Turning Point. Thank you guys for joining us today. Just since some new people just came on, just to let you know, this is being recorded. We will be posting this on our YouTube page and our Facebook page. If you don't wish to be part of the live event, you can watch it later. You can log off now and just watch it later once we post it, or you could change your name if you wish to just an initial or whatever you wish, you can do that. This is an education event. It's not a counseling session. And again, we will be posting this later if you wish to view it at a later time. So I'll go ahead and turn it over to Karen.
Okay.
Oh, and if you guys can mute, I'm sorry, if you can mute yourselves, just so we don't have background noise, that would be great.
Right. And any questions you have, if you want to put them in the chat, I'll address them at the end. And like I said, the Q&A will not be recorded, but you are welcome to put those in the end or just ask them live. That is fine as well. Aurelis is going to monitor the chat during our time together. So again, you know, if you want to be on video and have your name out there on YouTube and that doesn't matter to you, feel free to leave it on. If you prefer to keep things private, you know, you can turn off your video, shorten your name, put initials, or watch the recording at a later date. You've got a lot of options. So we want to make sure that you're comfortable with that during this education event. So that said, let's see. Let's get started. So common emotional challenges after breast cancer, how COVID-19 is contributing, which seems really appropriate given the state of things and how, you know, certainly we're in Georgia and how our numbers are going up right now. And I want to certainly thank Turning Point for putting on this event and thank our sponsors, Echelon Toys for Tots Golf Tournaments, for their generous donations to make this program possible. For the community. And I do, since I am a mental health professional, Karen Whitehead Counseling, and also a life coach, I do want to just put a disclaimer out there that for those of you who might just be listening to the recording, I'm going to go ahead and read quickly in case you're not looking at the slides, but the information provided in or through this presentation is for educational and informational purposes only and solely for your own use. The information contained in this document and presentation is not medical, mental health, or spiritual advice. And information in this presentation is not considered treatment and does not constitute a therapist-client relationship in any way. The information contained in this presentation does not substitute for actual treatment and does not constitute or substitute for the professional medical advice, diagnosis, or treatment by your own medical provider or mental health provider. So just wanted to make that clear for everybody. And I wanted to start off, you know, remember that game Whack-A-Mole? So we're going to just kind of dive right in here. But, you know, I was thinking more pinball, like a pinball machine ball bouncing around, but I couldn't find a great picture of that. So we went with Whack-A-Mole, which is pretty similar. But this idea that our emotions and our thoughts are all popping up and we're just constantly, you know, hitting at them and which one's coming up next. And it almost feels like they're popping in at the same time and you never know what to expect. And that's cancer right there. That's, you know, in my experience in working with people with cancer and breast cancer in particular, it is this jumble of, you know, not even a roller coaster. Sometimes it's not even just a roller coaster, might be even nicer, right? It'd be a smooth up and down. Sometimes you'd have this big curve, and it's not even that. It's like Whack-A-Mole. We're just constantly going through this range of emotions, sometimes at a rapid pace, and that can be really overwhelming. And COVID, right, is uncertainty. There's a lot of uncertainty in that. And so the emotions that we're feeling with that are also contributing to this Whack-A-Mole idea of emotions. And these are constantly popping up. And I wanted to kind of put a container around, around these emotions. And the container that we most often use when we're talking about this emotional roller coaster or pinball machine is from Kubler-Ross, Stages of Grief. And we see these kind of grief can be around anything. And often people don't think of cancer as grief or don't think of COVID as grief, but we're losing something with both of those. We've lost something. Something is different. We're missing something. And so grief is absolutely applicable. And the emotions that are in, and I have stages in quotes because when I think of stages, I think of something that's very linear, that I've done with stage 1, and then I do stage 2, and then stage 3. And they're not really stages. They're like whack-a-mole, right? They come up and down. So sadness and denial and anger and acceptance and negotiation. And so you may feel, you know, just really sad that your life is like this right now, or you're having to go through treatment, or you can't go out to dinner, or what around COVID, or whatever these different things are. You might have some sadness about those. You also might be in denial. Everything's fine, and I'm just living my life when things maybe are not so fine. You may be really angry. You may be angry at yourself. You might have some anger toward your faith. You may have some anger at the medical community or at society at large, depending upon what we're talking about. You may be in a period of saying, you know what, this is what's going on right now, and I've got it. I've got it. I accept it. I'm good. And that may be what you are experiencing. And then negotiation, or bargaining, as it's sometimes called, is, well, if I do this, then I can do that. If I wear a mask, then I can go to the store. If I eat better, then my cancer won't come back. If I exercise more, right? It's all this negotiation or bargaining that we do. And all of these stages are absolutely normal in any kind of grief, which includes cancer and COVID. So the fact that they bounce around, I just want to put that container at how common this is and how often this is a really normal reaction or common reaction to a traumatic event. It's an expected response to what's happening to you, to your body, to our, to our society, to, if we go COVID, right, we could get really big around what we're talking about. So it's really, thinking about it in terms of again, these stages, but these different emotions that bounce around can be helpful in knowing that this is a normal response to what you are experiencing. And I use the word trauma, and trauma can be a really sensitive word. According to the dictionary, dictionary.com, trauma, a deeply distressing or disturbing experience, emotional shock following a stressful event or a physical injury. So if you go with that as your definition, then cancer treatment, chemo, lumpectomy, mastectomy, radiation, oncology visits, scans, COVID, wearing a mask, fearing getting a virus, all of those could be deeply distressing or disturbing experiences. They are all trauma to a degree, and traumas, can be on a continuum, but I use this word trauma really just to give a label that this is a distressing experience. Being, sheltering in place or quarantining or, having to go through chemo or radiation or surgery, those are all deeply distressing. And again, calling it trauma is really just another way to place a container out around this as we talk about what's happening in your body or what may be happening in your body in response to these events. So when we talk about the effects of trauma, and I've got cancer, fear of recurrence, COVID, fear of death, the news, right? Social media, uncertainty. We've got trauma here in the middle that could be any of those things, not to mention other things, right? Like the other things that we have going on with our family, or with friends or with loved ones. There may be some other traumatic event that happens in your life or has happened in the past in your life that also contributes. And we're going to talk a little bit more about that. But this trauma affects our physical response of our body. It affects our thoughts. It affects our emotions, and it affects our actions. So across the board, you know, a traumatic experience or a deeply distressing event, if we want to soften it a little bit, affects so many different areas of our body's physical response, and then the product of that and what happens. And I want to talk a little bit about what does happen in our body when we experience a deeply distressing event. So, and again, for those of you who have joined late, I do want to mention this is being recorded for YouTube. So if you do not want to have, you know, your face or name on screen, please, you know, take action to silence that for yourself. So anyway, the impact on our physical body. So whether it's cancer or COVID or a bear or a lion, our physical body responds the same way. Our amygdala is the emotional center of our brain, and it responds to an event, whether it's cancer or COVID or your mother-in-law or a bear, or, you know, somebody's angry with you, or somebody cuts you off when you're driving. It responds to all of those events the same way. It can't differentiate that there isn't a bear in the room or a lion facing you. It can't differentiate that, okay, I'm getting a scan. This is what's happening. It thinks everything is a bear. So it's always on this kind of 0 to 60 timeline where it doesn't know the difference. It doesn't realize, your mind doesn't realize that, oh, I'm getting a scan and I'm not threatened in this moment, or I'm wearing a mask, or I'm at home and I'm worried about something, but I'm not threatened in this moment. It's going to think that you're threatened, right? It's going to think that there's that bear, that scary bear in the room. And what happens in our physical body is that it raises our heart rate. It increases adrenaline and cortisol production, which is part of what raises our heart rate. And we're in fight or flight mode. And what happens in fight or flight mode is we have about 30 seconds to make a good decision about what we're going to do about that bear. And truly, if there was a bear, right, you would make that decision and you would take action. But when it's a worry or, you know, something that is, you know, more of our story or our narrative, or, you know, maybe not something concrete, but something a little more abstract, we still experience that fight or flight, that rise of adrenaline and cortisol. And what happens after we have that initial, you know, 30 seconds or so of rational thought, we get impaired rational thought. So it's almost like pouring oil over an engine, this adrenaline and cortisol coating your brain, your prefrontal cortex, where you can't make a rational decision. You don't have clear rational thought. So when people say, well, I get caught up in that anxious spiral, this is why. It's because your reactivity is very heightened, and then we can't think clearly enough to bring it down. So that's some of the things that happen in our physical body that contribute to the emotional response that we're having. So this impact on our thoughts, we have repeated thoughts. What if this? What if that? Negative thinking. It's, you know, I'm not going to get better. COVID's never going to go away. And I've also used some black and white thinking there, which is that always, never, those extreme thoughts. Forecasting or predicting the future. My cancer is definitely going to come back. I know it's going to recur. Okay, that forecasting, that predicting the future that we do is also catastrophizing, the worst possible outcome. I'm going to die from COVID. I'm going to die from cancer, this catastrophizing. And there's a reason that our brain does this. So part of it is that traumatic response, that adrenaline and cortisol fight or flight that's flowing, preventing that rational thought. But our brain is always searching for certainty, even if it's bad. So we want to know the worst possible case to prepare for, even if it's bad. That just helps us feel more in control, even though we're not in control. So if you're having this, these repeated thoughts and negative thinking and extreme black and white, this, it's only this or only that, or always or never, that extreme thinking is really about your brain not being able to have that rational thought and looking for certainty. And obviously this is going to impact our emotions. And actually our thoughts come before our emotions. So when we're thinking negatively, when we're thinking in black and white terms, it actually increases our emotions. Sadness, anxiety, fear, anger, frustration, guilt, all of these emotions and more, right? I certainly could fill the page with a list of different emotions and negative emotions. But when we start thinking and worrying and thinking about, catastrophizing our situation, or that it's always going to be this way, it absolutely increases our anxiety. It increases our fear of what could happen. It might increase, that we're angry about something or really frustrated with a process or other people. And so that absolutely plays out. So these are all interrelated. And then our actions, when our thoughts are spiraling, when our emotions are heightened, again, all because of this physical response in our body to something we think is a bear. There may be crying and irritability. You may isolate yourself. You may not want to be around other people. You may have some low motivation or lack of initiative. You may not want to interact much with other people. You may avoid them. Or you may just be really, irritable with the people that you care about the most. So again, that goes back to that physical response in our body. And when we have cancer layered with COVID, layered with everything else in our lives that we already do and have experienced, we are highly reactive. So this slide, as you can see, now I put previous trauma here at the bottom, and some people have, what they would consider to be a deeply distressing event earlier in life or another experience. Some people don't. But we all start somewhere. And you add cancer to that and daily stressors to that. And then you get this really overactive amygdala, which, remember, the amygdala is the emotional center of the brain, the one that's controlling this fight or flight. And then when we add COVID to that, and maybe some more daily stressors, or maybe something happens with a family member that, again, you're feeling more stress, what's happening is your reactivity is just on the rise. It's just continuing to go up and up and up. And that emotional, that physical response is happening, and it just keeps reinforcing itself, because the more cortisol and adrenaline I have, the more fight or flight I have, the more I am fearful of other things in the environment. The more my brain is actually doing what it's designed to do, which is seek out threats in our environment and protect us. So when you're reacting with anxiety or reacting with irritability and have that heightened, your heart is racing and your palms are sweaty, what's actually happening is your brain is trying to protect you from what it thinks is a threat. Again, it doesn't realize that it's not a bear or a lion. It thinks that everything is that extreme. So your body and starts to react, and your thoughts and your emotions and actions follow in that extreme reactivity. And right now, especially since we don't have access to a lot of our normal coping mechanisms, because people are trying to isolate, people are trying to stay safe and healthy. So your old needs, your old ways to cope rather, might not work. Your needs are a little bit different, especially if you're quarantining or self-isolating or trying to be more cautious. And if you are dealing with current treatment, or are just starting into a different phase of your treatment, all of that is new. And so the typical ways that you have coped in the past might not work. You might be one who always went to the gym and that really worked for you, and you went to classes in person, and the communicating with other people and connecting in person really helped help ground you. And now maybe that's not as accessible. So we have to look at other ways that, to cope with these things. So looking at physical things, like, can I take an exercise class online? Can I make my workspace more ergonomic, or, a safe space for myself that feels, happy and energetically better than, sitting on my bed and doing my work? Can I give myself some time and space to really grieve this loss of freedom to move around society the way we've taken for granted, this thought that this grief that I can't do what I want to be doing because I have surgery scheduled or treatment scheduled, and giving time for yourself to really express that anger and feel what's going on. And we are going to talk a little bit more about some ways to do that. Socially, can you connect virtually? I know we're all a little tired of Zooming and, connecting online, or do you need time alone? And I encourage you, if Zoom is not your thing, and maybe, you're on this event today because, you were curious about the information and got on Zoom, but it's not something you do normally, it's okay to pick up an actual phone and call somebody. Having those connections when we're used to texting and used to emailing and not used to, to hearing somebody's voice can also be really reassuring. It doesn't have to be a video call or a virtual call if that's not something that, that you feel strongly about. Having a conversation on the phone with a friend can be just as impactful. And spiritual, really feeding your soul, your faith, journaling, meditating, and finding ways to do that within the constraints of what's going on now. These can all be grounding. And professionally, and I know this is hard, especially when so many of us are working from home, is setting clear boundaries between your work or school day and your private time, or your personal life, personal time, and your free time, between the weekdays and the weekends. How do you differentiate that? And it doesn't have to be some big routine or ritual that you do. It could just be a decision. It could be, okay, it's Friday afternoon at 5 or whatever time, you're done. And now it's the weekend, right? Just that mental shift of knowing that, okay, this is the weekend and I can put things aside that I usually pay attention to during the week. Giving yourself those clear boundaries can be really helpful. And other things that we can do to decrease this reactivity that, again, is so triggered by cancer, by fear of recurrence, by everything with COVID right now and the decisions that are happening around us regarding that. Always, sleep, nutrition, and movement. And I know the physical therapists at Turning Point are always really good about talking about, getting in movement. And Lisa's done some great presentations on nutrition, and all of those things impact our sleep. And it's really the full package. So the more we can work in all of these areas, and I am going to talk about mindfulness and that emotional, lowering that emotional reactivity, is really important to realize that it is the full package. It's not, I can't just focus on eating well. I need to also move my body. And I'm not talking about, really strenuous exercise. I'm talking about doing some stretches, doing some chair yoga, doing, going for a walk around your block. Simple things to keep you moving throughout the day. So even if you're in a place in your treatment that, walking distances isn't, it doesn't feel good, walk to the end of your driveway and back, and do that a few times during the day. It doesn't have to be just once. So be gentle with yourself about, what you can do and how you can fit that in and across your day. And that will help to really decrease your reactivity and lessen those effects of stress on the body. And when we lessen that effect of stress, that reactivity, we can actually think more clearly, because remember that the amygdala pours the adrenaline and the cortisol are preventing us from really thinking clearly. So when we lower that reactivity, then we can make good decisions, we decrease our anxious thoughts and feelings, and it all, helps us sleep better and make better decisions throughout the day about our nutrition and movement, and it's all interconnected. And this is just a little comic, I guess, I like about mindfulness. And when we talk about mindfulness, a lot of people don't really know what that means, or we've heard that word and think, okay, well, yeah, I'm mindful, or, I don't want to do meditation. And mindfulness and meditation sometimes are used interchangeably and sometimes are used differently. But we're going to talk a little bit about what being mindful is, because it doesn't need to mean that you meditate for 30 minutes a day, or that you listen to an app every day. It can mean so many different things if that's not up your alley, if that's not something you're interested in doing right now, that's perfectly fine. There are plenty of ways to stay in the present moment, which is what mindfulness is about, that we can talk about. And so when we talk about too much past and not enough presence, we've got all these, guilt, regret, grievances, sadness, bitterness, non-forgiveness. And too much of the future is that unease, anxiety, tension, stress, worry, all the fear, all that uncertainty. And you can see how heavy those are, right? They're boulders and they're about to topple over, but in the middle, we're actually okay. In the middle, we can actually realize that this is the present moment. And in this present moment, I might not like it, but I'm okay. And that's the piece that starts to bring down that reactivity in our body. And we know about mindfulness and deep breathing, and studies have shown that breast cancer patients who practice mindfulness or meditation, sometimes called MBSR, which is mindfulness-based stress reduction, regularly experience improvements in a lot of areas: in anxiety, stress, depression, sexual difficulties, immune function, distracted thinking, hormone-related symptoms, that emotional alarm bell, the amygdala, even your brain structure can change by practicing mindfulness or being more mindful. Your prefrontal cortex, which regulates your attention, emotion, and focus, again, that thinking clearly. The insula, which helps you tune into yourself and emotions of others. The hippocampus, that puts things into perspective. Mindfulness and deep breathing helps to impact all of these things in a positive way. And that goes to that neurons that fire together, wire together. So when we are in a consciously reactive, or consistently rather reactive state, when we're reactive to COVID and we're reactive to everything going on with cancer and we're in fear mode all the time and our reactivity is so high, what happens is those neurons keep firing together and they get really tight. They're like best buddies. And so every time there's a threat in the environment, they go, oh my gosh, we know what to do. We get stressed, we raise the heart rate, we feel anxious, we start ruminating on thoughts and all of those things, because your brain is a beautiful thing and it likes to pick up patterns. So when they fire together and wire together that way, it becomes a pattern, a habit, that when you're faced with something that's a threat, even if it's an imagined threat or something you see or hear and not necessarily something you experience firsthand, those neurons are going, oh, we know what to do. And so they start to fire together. And so what we want to do through mindfulness and deep breathing and exercise and nutrition and sleep and all of these things together is to train different neurons to fire together and wire together. Say, okay, when I see a threat, it's not a bear. It's not the lion. It's actually something in the future that I don't necessarily have control of. And right now in this moment, I'm okay. So reminding ourselves in the moment that we're okay can be really helpful. And mindfulness, the definition of mindfulness in Merriam-Webster's dictionary is the practice of maintaining a non-judgmental state of heightened or complete awareness of one's thoughts, emotions, or experiences on a moment-to-moment basis. Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. Jon Kabat-Zinn, and he's kind of the father of modern mindfulness and mindfulness-based stress reduction. So that's a kind of fancy way to say that. But when we are mindful, and again, we're going to talk about in a few minutes how to do that, it gives us space to ask, is what we're thinking true? Is it helpful? Is it inspiring? Is it necessary? Is it kind? So we can ask these questions when we have space. But when we're in that reactive mode, remember, we don't have space. So when we approach mindfulness, and again, all mindfulness means is that we're, present moment experience, without judgment, and we're open and curious. So these attitudes of acceptance and acknowledging without judgment, without trying to change. If we have pain and we're resistant to that, that creates more suffering. So really accepting where we are in the moment, being curious about it, investigating it, moving away from that autopilot mode of, this is automatically what happens. This is the automatic thought that goes with, one or the other. Then we can be more grateful and express gratitude for what we have. We can bring caring and forgiveness and gentleness to ourselves, be patient with ourselves, and have trust in ourselves. But we have to have the space to do that. And deep breathing really does give us space to do that. There's a reason that we connect the breath to mindfulness, or why the physical therapist might say, take deep breaths. So when we take a deep breath, and I don't think we're going to talk some more about that, but when we take a deep breath, what happens is we stimulate the vagus nerve, which is a two-way street running basically between our tailbone and our brainstem. And when we take a deep breath in our core and are relaxed, it sends a message to our brain that we're okay, that we don't need to be in fight or flight, that we don't need to have this adrenaline and cortisol continuing to go. And when we take deep breaths, we also stimulate serotonin, which is a calming hormone. And serotonin, most of that we now know is produced in the gut. So when we're stimulating that, that's another signal that, okay, there's not a bear or a lion in the room. And when we bring down our heart rate by deep breathing, that's another signal that, okay, we don't need to be in this reactive mode. So being mindful is really about, taking the time to remind yourself that you are, in fact, in the present moment and okay. And some other ways to bring down your reactivity is to label the fear. Write it down. I'm anxious. I'm afraid that I'm going to get COVID. I'm afraid my family's going to get COVID. I'm afraid my cancer's going to come back. I'm afraid I'm going to be sick during chemo. I'm afraid I'm always going to be thinking about this. Whatever it is, label it. It's anxiety, it's fear, it's anger. Write it down, because when we write it down, we actually relate to it differently. When we write it down, our brain processes it through a different channel than when it's just going on through our minds. We have something like 60 or 70,000 thoughts a day, and most of them are not original. And most of them are not true either. So they keep cycling. And when we write it down, we have a different perspective. Getting out in nature is another way to bring down your reactivity. Just, looking out a window if you can't get outside, and focusing on the colors that you see, the wind blowing, what you might smell, all of those pieces. Anything sensory can be very grounding. Pets, and I got a picture of one of mine on here, can always be very grounding as well. and moderating or reducing your news consumption, especially right now. Things are so heightened. Every time we read something, right, our brain is seeking out threat. So if your brain picks up on something in the news as a threat, whatever that may be, it is going to heighten your reactivity. And I'm not advocating for totally, disregarding or not reading or keeping up with news. I think, there's importance there, but really look at, do you have notifications that pop up on your phone constantly all day long? If you do, turn those off and really be intentional about when you take in news or how you take in news. Give yourself a period of time during the day that you look at that or review it for yourself, so that when you do, you can already be in a lower state of reactivity. So, don't look at it when you're sitting at the doctor's office nervous for your next appointment, or whatever you're going through at this moment. Pay attention to when you're looking at the news, so that it is, a time when maybe you have lower reactivity, more rational thought, when you can say and take in that information in a healthier way. And certainly talking to a therapist. And I am always happy to help people find a therapist to talk about what therapy is or could look like. That's certainly something that can be helpful during these trying times. And I do want to say, if you're interested in more, I have a self-care download on my website, which is KarenWhiteheadCounseling.com. And there's a new book out called Mindfulness for Challenging Times. And it's a book that I contributed a chapter to. My chapter is Mindfulness for Helping Professionals. So if you are in a helping field, that could be applicable, but the book truly is everything from mindful parenting to mindful eating to mindfulness for anxiety, for sleep, for media coverage or media consumption. There's 26 or 7 chapters, and each chapter is written by someone from a different part of the world. It's 26 authors who have come together to pull this book together. And I highly recommend it. It's got some guided audios with it that can be really helpful during this time. It came out, we put it out in April. We started working on it, especially for what's going on in the world and this time. So while it doesn't speak specifically to COVID, there are some COVID references, and also have different chapters that might be really helpful at this time. And Turning Point, we want to again thank Turning Point and Echelon Toys for Tots for sponsoring this educational presentation. And I want to turn it over to Aurelis, and then Aurelis can turn off the recording, and we'll go ahead with any Q&A that, again, will not be recorded.
Karen, it was a fabulous presentation. Thank you for taking time to share this information with us, and we appreciate everyone that did join. If you're not aware of Turning Point, Turning Point Breast Cancer Rehabilitation is a 501c3 nonprofit organization. We're able to provide these education events once or twice a month because of sponsors and donors, and they're complimentary. If you wish to donate, if you appreciated today's event and you wish to make a donation of any amount, you can just visit our website, myturningpoint.org, and you can make a donation there. So I'm going to go ahead and stop the recording now.